So second topic is going to be hair loss in adult women. And so adult is a kind of a very big spectrum. So I'm going to discuss hair loss in, postmenopausal women. And when you think of hair loss in postmenopausal women, you also have to think of aging. So how much aging is involved in this hair loss? And we know very well that with aging, there are important changes in the hair shaft. The hair, the diameter is reduced, and the hair increase its curvature. And of course, there is a decreased melanin production, there is decreased density and sebum production. But we know, even if we know that, there are not necessarily these changes cause a visible hair loss. And if you look at the data of David Whiting about senescent alopecia, it's not so common. If we look at the numbers that he produced on pathology, not many cases, but enough, he found that in women there is a small decrease, but not a big decrease with aging, you see. And you see here the different age group, and you see the reduction in the hair count was not so important. So we have to think that maybe senescent alopecia is not a real reality. So, and there are many women, even at old age, with a very good density. So the reduction in the sebaceous activity, you can see that with dermoscopy, the so-called dirty scalp, and you see that the scalp has these particles because they cannot be removed because the sebaceous glands do not produce sebum. So graying is an important part. Why? Because graying contributes to the perception of hair. For you to dye your hair, most patients die maybe every 6 weeks because they are afraid that dyeing is going to cause a problem. In reality, this is very wrong, because the white hair look at the eye as a thinned area. And so we know that female pattern hair loss is common in women, especially after menopause, okay? And it's not always pattern. So the role of the androgen is not so evident, as there are cases of androgenetic alopecia without androgens. Even without androgens, there are cases of androgenetic alopecia in women with a genetic disorder of the androgen receptor. So these women cannot be due to androgen. So definitely we all believe that there is something else. But in menopause, there are a lot of discussion on estrogen depletion. There are many doctors, I don't know in Brazil, but for instance in Italy, that prescribe topical estrogens for treating female pattern hair loss after menopause. I really don't believe in that. There is something indicated that androgens and estrogens are important. For instance, we know that alopecia very similar to androgenetic alopecia develops in patients with breast cancer taking aromatase inhibitors or tamoxifen. So estrogens are important. But on the other hand, we know that these patients don't improve if we place them in systemic therapy with estrogen, and they also don't improve with topical estrogen. I've tried to use topical estrogen in many instances, and I'm really convinced that topical estrogens are not really effective. Keep in mind, in these women, you have to ask, because at least in the United States, all women take bioidentical hormones, and they believe bioidentical hormones are natural. And so they don't tell to you, because this is not a treatment, it's like a natural supplementation. And testosterone is frequently utilized in these bioidentical hormones. So after menopause, you see an increase of the Hamilton pattern, which is quite characteristic. And another feature that you usually see only in postmenopausal women is this focal atrichia. So if you look with the naked eye, it looks like the patient has area of scarring alopecia, but you know, it's not that. It's just like miniaturization of several adjacent follicular units. So possible treatments: topical minoxidil, of course, yes. Finasteride, dutasteride, yes. Light, low-level laser therapy, yes. Spironolactone bicalutamide, no, I never give this treatment in postmenopausal women. As I said, I don't believe androgens really play an important role. So those are treatment for young women with seborrhea and other problems, not for postmenopausal women. Be careful with oral minoxidil in this population, because you know you have really to do a good cardiovascular history before.